everybody!
Dr. Stoop here to discuss the most hot, controversial, and complicated topic in the United States today: healthcare reform. Healthcare in America is backwards and broken. I live on the front lines of healthcare in America. I work at a inner city hospital in central Brooklyn, and it's a public hospital. So I end up with the patients who either don't have insurance or lost their insurance. And daily I hear horror stories about the way people have been screwed over by the healthcare system in America.
Now I'm going to tell a few stories that are typical of real patients I see. And these are just some examples of actual patients that have very similar stories about how they're neglected by the healthcare system. Our first patient, she's a 60-year-old woman with diabetes and hypertension. Now, she had been very compliant with her medication, takes every dose of every medicine, follows up with all her doctor's appointments. Unfortunately, in December, she fell down the steps and injured her back. After a month or so of not being able to work anymore, she lost her job. And when she lost her job, she lost her insurance. Then she could no longer go to her regular doctor's appointments or get her medicines without paying for them herself. So she ended up in the emergency room in July, and she was complaining of a headache and seeing things floating in front of her eyes. Her blood pressure was 218 over 120. That's very high, and she was having symptoms because it was so high. When asked, why she wasn't taking her medicines, she said, "I ran out of them 3 weeks ago because I couldn't afford them anymore." Now she's at a time in her life where she needs health care the most because she injured her back and walks with a cane. She lost it, and her diseases are getting worse since they're out of control. This is typical of the patients I see. Here's another story that's along similar lines. A 37-year-old male with diabetes doesn't have insurance because he can't really work more than a few days, because after you have diabetes for a long time, you get neuropathy. Your feet start to hurt. Your feet feel painful with pins and needles. So he can't work more than a few days, and he can't have a job that gives him insurance. He can't afford insurance because of this pre-existing condition and the fact that he doesn't have a regular job. Now, I saw him several months later admitted to the hospital. He had put off coming to the doctor because he couldn't afford it, and his diabetes had been getting more and more out of control. His sugars were sky high for months. What did this cause? One thing, he basically went blind because he started having diabetic retinopathy, and he actually had a hemorrhage. He had bleeding in his eyes, which made him go blind. When he came to the emergency room for that reason, he had kidney failure. His creatinine was like 16, which means his kidneys aren't working, and he needed to start dialysis. So now you have someone who couldn't get insurance and couldn't get medical care because he couldn't afford it, and now he's going to be a much greater burden on society because he's blind and he has kidney failure requiring dialysis. Where if he could have just gotten a few simple medications and follow-up doctor's appointments, it could have prevented this poor guy from becoming blind and having kidney failure. The uninsured have a much higher morbidity and mortality than the insured. That means they get sick more and they die earlier compared to people with insurance. This is healthcare rationing American style. There's 47 million people out there who don't have access to healthcare. Story 3. Here's a story of someone who has health insurance and was still screwed over. Okay? This unfortunate woman came to the emergency room and we diagnosed her with pancreatic cancer. She was only like 58 years old, okay? And so we wanted to get a biopsy, find out, one, what kind of pancreatic cancer it was so you could start treatment as early as possible, and get the biopsy as soon as possible so that we could start treatment as early as possible. So we kept her in the hospital 2 more days so she could get the biopsy in-house rather than sending her home and having her come back for the biopsy, because that would have taken 2 more weeks to get the biopsy. Plus, she would have been in limbo for 2 weeks knowing she has pancreatic cancer and not knowing what kind or what the treatment plan is going to be. So we kept her in the hospital 2 days, got the biopsy, and then she went home. Her insurance company rejected the admission. They said, sorry, you have to pay for your entire hospital stay because we think you should have gone home and come back 2 weeks later. That's morally reprehensible. That's pathetic. That's so sad. You know, you would hope this lady could have saved some money for her funeral and burial, finding out that she has pancreatic cancer, only now to find out, oh, she has extra $5,000 to pay because her insurance company, who's supposed to take care of her health, is gonna stick her with the bill just because she got cancer. And she wanted to find out, she wanted to get treatment starting 2 weeks earlier than if she had gone home and come back for the procedure. I can rave on and on about how instead of spending time with my patients, I have to spend time on the phone arguing with insurance companies. Instead of me deciding what's best for my patient, I have to argue with the insurance companies who are saying what I can and cannot do for my patient. Every time a patient comes in with a different insurance plan, I have to spend time looking up that specific insurance company's formulary to see which drugs I can and can't prescribe for my patient.
Despite my personal experience, how do we know the healthcare system is so bad? Well, let's look at health indicators. What are health indicators? The mortality rate in the United States is worse than any other developed country. That means people don't live as long in the United States. People live longer in Canada, United Kingdom, France, Germany, Japan, Australia than they live in the United States. Meanwhile, the United States spends much more than any other country on healthcare, and the amount they're spending still leaves 47 million people uninsured. Infant mortality in the United States, worse than any other Western country. That means infants die more in the US than in Canada, Germany, United Kingdom, France, Japan, Australia.
Despite the fact that we spend twice as much as the next country below us, meaning we spend around $16,000 a year per family. Switzerland, the next most expensive healthcare spending country, spends around $9,000 a year per family.
Something's wrong with this picture. So how come our outcomes are so poor compared to all the other countries, even though we're spending so much? Because our system is broke and backwards.
Click on this link to find out more background about why our healthcare system is so busted. If you already know why our healthcare reform system is so broken, click on this link to find out the specifics of the healthcare reform legislation. Click here to proceed to a more general theoretical explanation of the healthcare reform legislation.